Okay, so particularly we've noticed with the COVID virus especially, but viruses, usually respiratory viruses, attack the body through the nose. So the aerosols spread, as we're all hearing about, or airborne viruses, you breathe them into your nasal cavity and they bind to receptors in the olfactory region. So the binding to these receptors then can knock the receptors off or block pathways in the receptors, that therefore mean that they can't bind, or do bind, but no longer the pathway is working. So smells, when they reach that olfactory region in the nose, there's a loss of signal transmission to your brain. So we're no longer picking up those odors. So it's the receptors and the sensation of smell, even though the molecules are still hitting the region, we're no longer triggering a response in the way that they were before. The good thing with post-viral, of all the different causes of anosmia, it's one of the ones that can improve with time, and there are many things we can do to help improve it by doing exercises and things like that, which we'll come on to a bit later. But certainly we're looking at the olfactory region, and we're looking at those olfactory receptors, of which there are hundreds and thousands in the nasal cavity, and all those neurons connect up to the brain, and that's where we get the sensation perceived.
So it's a point of a translation in between whatever is in the air that you breathe up into a brain signal, effectively.
Exactly. Wherein we compare that to, say, somebody who's got really bad nasal polyps with chronic rhinosinusitis. For those people, their smell receptors are still working properly. Their problem is that their nose is just completely clogged with nasal polyps. So the smell can't actually reach the olfactory region. So the olfactory system in those people is working really well. The receptors are working. But if you've got a mechanical obstruction, then the smell cannot reach the olfactory region. So the pathway is blocked earlier, whereas later on with, or we talk about it as being like conductive or sensory neural, the same way we think about hearing loss. So conductive is the smell's not reaching the receptor. Sensory neural is the receptors not triggering the nerve response. So those are the two different types we talk about.
So it's very different in this case. When you said a virus is binding onto the receptor, so it means that the signal is then either stopped or changed. This is different to having a blocked nose because we've got a very heavy cold, for example.
Yeah, so most people in their lifetime will lose sense of smell and have hyposmia as a result of a cold. Almost everybody will have had it at some stage with flu or a bad cold, but in most people it just improves after that, and not so many are left with a residual deficit. Although that said, around 15% of the UK population do have anosmia, and one of the most common reasons is post-viral loss of sense of smell.
15%?
15%. Yeah, have a reduced sense of smell.
Good grief. So coming back then, so the virus then binds onto the nerves at the top and it blocks the signal getting through. Or you said also changes the signal as well. Could you just open up a little bit of what you mean by block and change?
So sometimes a virus can affect the receptors, we think, themselves, and sometimes it can alter the way the receptor is triggering, is what's thought. And there can be upscaling and downscaling of different receptors by factors in the nose. So if you're only picking up some smells, it can be because some of the receptors are working better than others. And some smells are triggered more than others, particularly people in parosmia find things like that. So some smells return quicker than others because of the way the receptor works.
From my understanding, parosmia can be a sign that actually there is development going on in the olfactory area, and that it can mean that you're progressing towards maybe recovering some more smell. Parosmia isn't always permanent. It can progress. Things change. For me, it changes all the time at the moment, but obviously I am in the post-viral group, so it's different for everyone.
Thank you. As I understand it, it's that translation is just mistranslating at the moment. Translation in between what's coming into the nerve and how it's going into the brain. It's
exactly, complete misfirings. Yeah. So, for instance, you have many, many receptors that are responsible for smell in your nose. And when you suffer from anosmia or hyposmia or parosmia, some of those receptors aren't picking up on certain smells. So you're almost zoning in on one receptor, and then that receptor becomes like very overpowering for you. And instead of it being a pleasant smell, which it normally might be, it becomes an unpleasant smell.
Yeah, that's certainly what we think, that classically with normal post-viral, what we've known about long before COVID was once you got your parosmia, it was a sign that the smell receptors were improving, things were getting better. And it was about those retraining the nerves to recognize what normal smells were again, in order to pick up what you would enjoy smelling and differentiate between smells. So once you started getting the parosmia, something's kicking back in again and something's coming through. So that's the time where we were thinking that olfactory training was really important for people, and doing smell training at that time is really useful. Encourage you to differentiate between different smells. And smell training is a long drawn out thing. It's not something that changes overnight. I know many of my patients have been disheartened with no improvement in 2 weeks. We certainly don't expect it to be a quick thing. And of the patients we're seeing with the post-COVID anosmia, particularly in our study at the moment, we're finding a lot of people improve within 2 weeks, but there's still about 10% that don't improve in those 2 weeks and are still having significant problems 6 months on, with parosmia and hyposmia that's ongoing. And those people are actually gaining some benefit with the olfactory training that we've been doing with them. Well, Lizzie, for example, is 6 months out from her COVID diagnosis and still has ongoing parosmia, and that's quite common in our patient group. Obviously, we don't know exactly at the moment. There have been some studies in the past saying people have still shown improvement with post-viral anosmia beyond a year. So they've had parosmia, and even more than a year afterwards, things have returned at a later stage. So there is hope that it can get better over a very long period of time. So there was, I can't remember the exact percentage of a recent study in 2016, I think it was, that showed post-viral anosmia recovery in people who'd had post-viral anosmia for more than a year. So it's not something we should give up on straight away, and it's definitely worth continuing with smell training when you can, and just thinking about things as you eat them and trying to use your memory and different evocative things to make you think about the smell when you're eating something or cutting a vegetable. Try and stimulate your brain with lots of different triggers for that smell. In the similar way to smell training is just focusing on that smell. It's about concentrating on, if you were cutting up an orange, the taste of an orange, the smell that you remember of an orange, and trying to evoke that again as you're doing it. Many different things can influence the way you perceive smells. People in times when they're scared and fear often find they have an excess awareness of their sense of smell, and that's thought to be part of kind of fight or flight and awareness of your surroundings from you know, when it was safe for you to go out and hunt and a hunter-gatherer time and being aware of danger. So it's thought that there many different things can influence it, and certainly being part of a communal setting and different things like that, and mood, even different hormone statuses can affect the way we perceive smells. And it's not something even in normal people that remains constant all the time. There are times when you'll pick up bigger smells more clearly than others. No, exactly. And that's why we encourage people to smell and taste and bring up their memories to reinforce that sense of smell, particularly as they're trying to recover and improve. I don't know what people have found that's particularly memorable or an imprint in their memory of a particular time. Some people it's the salty water being on a beach, the seafront and things like that, or walking down right past a garden with a freshly cut mown lawn and things like that. So it evokes a time and a place and a memory, and things like that can trigger a stimulus occasionally. as I say, avoiding the triggers to try and not smell it. But also, the more you do things like smell training and get other smells improving, you may find that parosmia diminishes in intensity over time. So continuing with practicing regular smell training, doing regular nasal douching, and when you have that foul smell, I know it sounds silly, but it's trying not to focus on it or think about it, or trying to distract yourself with something else, which I appreciate is easier said than done when it's something of that intense in front of you. But it's trying to, it's almost like we say with tinnitus, when people have a constant noise they're hearing in their ears, we try and tell them not to listen for it, which is a similar thing with parosmia. If there's a really unpleasant, disgusting smell, it's trying not to focus your attention on it, which I appreciate is something very hard to do. But you may notice yourself that it's less apparent if you're really concentrating on something or really focused on something, and people seem to be less bothered by it. So it's trying to train your brain not to pick it up in the same way. So for treatment of sinonasal disorders, there's a lot of evidence in a Cochrane review that will all recommend sinus rinsing. It's certainly something I give to all my post-operative patients and people I see in clinic. It's one of the first things we get people to do. It's making if your nose is very blocked and there's lots of thick, sticky mucus in there, using the douche to help clear it out means the mucosa can start working again properly. And your nasal mucosa is lined with what we call a ciliated epithelium. So it's got lots of little finger-like projections on it that kind of waft the mucus backwards. And if there's lots of thick, sticky mucus on it, they're not really working properly and wafting the mucus around your nose, and it can get blocked and crusty. So if we can flush that all out, or get rid of any allergens or pollens that are blocking or creating an inflammation in the nose, then that just promotes healthy nasal mucosa and sinuses. So, as I said, with just rinsing out the nose with salty water, there's not really any side effects or any worries to do. It's just time consuming, and it's trying to get it into people's daily routine to mean that it's something that they're prepared to invest time in and do. So many of my patients will prepare a bottle and do it after they wash their teeth. So it's a time of day where they're doing a routine, and it's part of that morning routine that they rinse their nose after they've cleaned their teeth, for example.
Thank you. Really, just to back that up, I mean, the routine is really key on this one. If I can offer a way that I made it easy, boil the kettle, put the water in a mug, put a timer on for 45 minutes. Might be between 45 and 50 minutes, depends how cold your kitchen is. And then you'll have a mug of water exactly at room temperature. And then if you find that way, as Lizzie said, as Cath said, it's like finding a way that's actually linked into your daily routine. So at some point where you boil a kettle and then you're still around an hour later to do that. Boiling water, very important, isn't it? I had somebody sort of saying the other day that it wasn't so important. Big nods from Lizzie.
Yeah, no,
yes.
Definitely boil the water. We're not sure what exactly or how clean taps are, what's coming through. So it's definitely better to boil it first before you put it through the nasal cavities. But obviously make sure it's cooled down. And we don't want water that's too cold either, because you can get an ice cream kind of cold headache from that. So it's kind of body temperature water, like a baby's bath water type thing you're looking at.
How do you do it?
There you go, Lizzie. She's the expert in clinic. She teaches all my patients to do it.
I can imagine.
So, I think I could see that you said you've got Neilmed Sinus rinse, which is we might have one. No, like a squeezy bottle with a capacity of 300 millilitres, I believe, and it has like a little nostril-shaped top with a hole in it, and you put the Neilmed sachet contents into the bottle, fill it with boiling water, leave it the amount of time to come back to room temperature, maybe just above, and then lean forward. I find to do it over a sink, so lean right forward, pop the bottle in one nostril, squeeze until you've done half of the bottle, and it should be flowing out of the other nostril. Doesn't always do that, sometimes comes out of your mouth, but that's also normal. And then do the same with the other nostril. So half the other half of the bottle in your other nostril and flow out of your other nostril.
Smell training. Take us right back to the beginning. What is it? How do people go about it?
Again, I'm going to leave Lizzie on this one because she's the one who's been doing it daily, so she's probably more up to speed with it than I am. But the concept is that you have different smells, you smell them at a regular time frame, and you spend time trying to differentiate them and really trying to work out what those smells are. Go on, Lizzie.
So I use the 4 recommended smells, I think, as per Prof. Hummel.
Yeah.
So they are eucalyptus, clove, rose, and lavender oils. It works best if you get yourself 4 little jars, and then pop some drops of the oil onto either a cotton wool pad or lint paperwork, and put that inside the jars, each individual jar, because it helps to sort of release the smell into the jar, and it creates more smell particles for you to give your nose a chance to smell it. So you should do that at least twice a day. You smell each jar for 30 seconds per jar, and give yourself a minute break in between each jar so that your nose can sort of reset itself, and then do the same the second time in the day.
Is anybody here doing smell training themselves, and how have they found it? And are there particularly smells that people are picking up that are better than others? Because I know, Lizzie, you could smell one for a long time before the others.
I could smell lavender, clove and eucalyptus quite well, but rose was really quite minimal. Luckily that's picked up a bit now, but I'm hoping that's down to persistence with the smell training.
You're still doing it, and how long have you been doing it for now?
So since it happened at the end of March, maybe a month later than that I began. So I'd say 6 months or so now.
And how do you do it like daily? When would you do it?
For me, I pop it next to the mirror where I have my makeup, and I do it at the same time. Maybe even in between doing makeup, but it works. So whatever works for you. Might be that you put it you can put it in the bathroom actually, really, but somewhere in your routine where you're going to get a memory trigger for it.
So it's rather than, you talked earlier about saying it's an investment of time, but actually the way you've got it into your day, it's not that you have to sort of clear the decks and do it. You've actually managed to fit it in. I've also heard the other way as well, though, that actually where people have a more of a ritualized way of doing it, the activity of doing the smell training, and also it's that I'm doing something for myself. I'm doing something that concentrates on my smells. I mean, I've had both sides of the experience. How do you work with people to find the space in their days? What's your attention? What's your advice you give? Yeah.
I think also there is an element of spending that time to really concentrate on the smell that you're smelling, and as Cath was saying, like the association of the smell. So if you remember what that smell smelt like before, it's picturing it in your mind, maybe closing your eyes as you're smelling it, to really try and encourage the nerves to pick up on that smell.
Not at all. That's the one that's commonly recommended from Professor Hummel's group in Dresden with the smell training. That's where it came about. But certainly smell training can be any smell. And that's what I was talking about earlier with like slicing into an orange and that evoking of a memory with it. A smell that you like, smelling your coffee and things like that. It's just about giving yourself time to think about a smell, try and evoke memories of that smell, like walking past cut grass and really thinking about it at that time to bring these smells alive in your mind. So you're training yourself to pick up on any cue that might be there, however weak it is at that time. So you can really focus it and try and strengthen the nerve receptors to pick it up gradually.
So in some ways, sort of, because there's a real clarity, isn't there, with the essential oil smells and the strength that they can have with them. But then the advantage of using household things such as an orange, which I could then go back, remember the time I ate an orange when I was a child, what was that like? And then I could actually then evoke the memory in there as well to link it up. Surgery, possible route.
For post-viral loss of smell, then there's no real indication for surgery at all. Surgery for loss of smell is not really something we think about until the end of the line, and that's only for people with chronic rhinosinusitis with nasal blockage, or where there's a physical obstruction of air getting to the olfactory region we saw at the top of the nose. And we try initially medications to reduce any blockage or swelling and things like that. And it's only if those weren't working would we then consider surgery. And even if it is things like chronic rhinosinusitis with nasal polyps, if we operate, the surgery itself has a risk of reducing smell because you can get scarring in the area. And then when we operate on polyps, they often recur afterwards. So it's not the be all and end all, unfortunately. It's not always the perfect answer for returning. So I think there's only a very, very limited role for surgery in this, and it's in very specific indications. Certainly post-viral, when it's to do with the nerve receptor pathway, then certainly we are not down to that microscopic level of surgery as yet to work on individual nerves. But there are things coming around and different research looking at things that can stimulate nerve transmission and different medications that may or may not work on it. But quite a lot of that is still in a laboratory at the moment and hasn't yet come to clinical practice. But the good news for post-viral loss of smell is because it has come to the public attention so much at the moment through COVID, and it being part of COVID diagnosis means that there has been a lot more interest in research on it. So hopefully this will eventually translate the better treatments and outcomes for our patients for all types of post-viral loss of smell. So I think that would be a real positive that comes out of this.
What can we do if steroids help, but we don't want to take them orally?
So one thing just to remember with steroids, when you've got an acute infection, we tend not to give the steroids. So if somebody's lost their sense of smell and has a COVID diagnosis or a recent diagnosis, we usually wait until it's 3 weeks after diagnosis before giving any oral steroids. So we don't want to suppress their immune system when they're getting an onslaught of a potentially nasty virus. But in most post-viral loss, we would give it earlier than that. And we'd normally give a week-long course of a steroid. Side effects we're thinking about, lots of people don't sleep well when they're on steroids. Their appetite goes up while they're taking steroids. There's an increased risk of gastric ulcers and reflux. And many people, it completely can make them very weepy or upset or very angry. So it can almost change people's personalities in certain instances. Steroid psychosis is something that people talk about. It's very rare, but it's certainly nothing to be taken lightly. We can give steroid nasal drops, which are focused on the nasal mucosa. They're not systemic, and it's a much lower dose, so it's not absorbed in the same way, and it avoids many of the side effects of taking oral steroid tablets. But certainly many of our patients with loss of sense of smell would try a short course of oral steroids, but we would give them warning about side effects that they may occur, and if they do get them, to stop taking them. And then we may consider the steroid drops, such as betamazole nasal drops or fluoxetine nasules would be typical things. So betamethasone or fluticasone being the steroid in those drops.